Welcome back. To complete our discussion, talking about blood and blood services, joining me again is Dr. Mayjean Fusi, American Red Cross Southwest Region Medical Director. Let's jump in.
Okay.
Now, as promised, I want to ask you about people who may be using illicit substances. Can they donate? And what would be the, tell me a little bit about that, because people are concerned about that.
Yes, and I can understand that. The one thing that we do ask about was actually a couple of questions. One is IV drug use. Have you ever used illegal, non-prescribed drugs by needle? And unfortunately, that also catches individuals who have taken steroids, let's say for sports reasons. You know, oh yeah, my coach gave me a shot. We don't like to hear that sort of thing, right? But we do ask specifically about IV drug use, because that is definitely one way where transfusion transmissible infections can happen.
Okay.
So we do ask about that. But as far as, like, let's say somebody who's using amphetamines, we don't ask a question about that. As long as they're not using it via IV needle, intravenous needle injections, it doesn't get elicited as such.
Okay, so individuals who are using some illicit drugs by IV use, they are not eligible for donation.
Correct. The other thing I want to add on to that too is a sexual partner of someone who does use it is also a deferral reason. Okay, so we do ask about that indirect
that
relationship there.
Now, people do wonder about, because it's not, of course, the way it is today as it used to be, but some people sometimes think things are like they used to be. HIV and AIDS, in terms of donations, being able to get that from the blood. Let's clarify the current status of that and where we are today.
It's still very much a concern. However, over the last 5 to 10 years, we've added additional tests, which are that much more sensitive and capable of picking up an infection. However, that's not ever going to replace the questions we ask. And we actually ask a lot of questions having to do with HIV, as well as other transfusion transmissible infections like hepatitis B, hepatitis C, any of those also. So we still ask questions about whether or not a male person, male donor, has ever had sexual contact with another male since 1977, ever, since that time. The other questions we ask about are individuals who might have accepted money or drugs in exchange for sex. Again, putting a person into a risk category that gives them a higher risk of maybe having one of these infectious diseases. So we do ask a number of questions having to do specifically with HIV, as well as some of the other, like the viral hepatitis.
Okay, and would that include people who may have had multiple sexual partners? Are there questions such as that? Because as we know, that can increase risk factors too. Is that a consideration too?
Now, interestingly, there will be people who say, well, you're still asking that question about male-to-male sexual contact. What about the number of partners? No, we do not have a specific question that asks, you know, how many sexual contacts have you had in the last 12 months. There's no question like that. But there are questions, like I mentioned earlier, about sexual contact with a person who has accepted drugs or money in exchange for. That's certainly one. Persons who has had sexual contact with a person who has HIV definitely is also a deferral.
So you have enough questions to get at those kinds of things.
I think so. And then the testing is that other additional point where we can check in.
Well, let me ask this question in terms of, let's say, persons who have received donated organs. Can they donate? And tell me a little bit about that process.
Interesting question. I don't think the normal public would necessarily think about it, but we actually have accepted individuals who've received, say, like a kidney transplant. Now, there is a deferral period of 12 months after that organ transplant has happened. That 12 months is to give that person that time to say, okay, they might have acquired something through the organ transplant. That 12-month period should give them the time for them to, say, like develop antibodies and other things that will allow our tests to pick up and detect. But the person also will have to be healthy at that time, because unfortunately, people who do receive organ transplants sometimes continue having problems.
Now, in terms of sometimes, because you do give snacks and juice and things like that, in terms of replenishing, you know, are there sort of restrictions that may occur if a person has had an organ transplant?
Not that we have anyway. I mean, when I say we, I'm always referring to the Red Cross system. Because, yes, even though we're all under FDA, Food and Drug Administration regulations, we as a blood industry do not all have exactly the same criteria. But as far as that piece goes for the Red Cross, no, it doesn't apply.
Okay. So you may find out, get questions that may ask in terms of any sensitivity to any types of foods or things like that, so that you make sure, or are your snacks, I'm thinking about people that have allergies to certain kinds of things. Are your snacks so universal that even if you had, say, a peanut allergy or others, there's not going to be a risk factor for that individual? So are those questions that you ask people about allergies or sensitivity because you know you're giving those kinds of refreshments?
True. Yeah, we do not have a specific question on that.
Okay. Okay.
Yes.
Well, we might look at that.
We might, and that, it's one of those kind of things that if it doesn't come up, it's not necessarily going to be looked at.
Okay.
And as far as I know, it hasn't come up as such. Now, interestingly, we have collected at a high school where there was a student with a very severe peanut allergy that was told to us before we had the blood drive. Knowing that, what we ended up doing was that we just had to make sure that the individual knew that on a certain date we were going to be there to do the collection.
Okay.
And so we took that precaution. But again, we do it if we know about it. If we don't know about it, we're not going to be able to respond.
Okay. So people donating, if they know they have allergies or sensitivities, they need to make sure they're bringing that forward
definitely.
to the system.
The other allergy that can be of significance is latex allergy.
Yes.
Because we still have a lot of supplies that do have some latex in it.
Okay. Let me ask this question here in our time too. Sometimes people think that only certain blood can be given to certain people. Now, we talked about the universal in terms of the O and that can O positive being able to be given to others. But sometimes people think that by race or by your background, you have to have blood from that particular race. Let's blow that myth away. We did talk about the universal donation. Not at all true, because sometimes people think, well, if I take blood from a person who's an Asian person or a European descent and I am not, I don't care what they say, there's going to be some reaction someplace.
Well, let's take it from the hospital side, okay? Once we've collected the blood and done all our testing and everything, the hospital is now responsible for checking that that unit of blood you're taking off the shelf is going to be compatible with this specific patient.
Okay.
So as long as those testing done at the hospital are all fine, that unit will go to that person.
Okay.
So it comes right down to what you're saying. We don't know if that, at the hospital again, we don't know if that unit is from an African American or an Asian or a Caucasian or European. The only thing that's labeled on that unit is a whole blood number.
Right.
Okay, so there's no way a hospital could select for that. But let me turn this around if I can, and that is, let's say the sickle cell patient, and sickle cell patients are very often having to need breast cells, right? So what ends up happening is that the sickle cell gene, that sickle cell trait, happens most often in African Americans here in the United States.
Okay. Go quickly.
Right.
Yes.
What ends up happening is that the best units probably will be found among African American donors.
Okay.
Because again, we're talking about the genetic similarities. Okay, so a sickle cell patient has so many transfusions that they have the ability of developing antibodies. And the best way to prevent that often is to match their blood for other antigens. Remember I said there are hundreds of other antigens on red cells, is to try to match more of those.
Okay.
And the best matches usually will be found in the same ethnic racial group.
Okay, so, it may be helpful in some respects, but it's not the universal approach.
Definitely not, definitely not.
Thank you so much. I know that was fast and we're out of time, but thank you so very much.
You're welcome.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your comments, questions, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me at YouTube at youtube.com/HealthAlertUSA. Take care, and remember, donate and save a life, because you never know when you may need some as well. Take care. This program would not be possible without the support of OU Physicians in Tulsa.